Welcome. I'm Laura, joined here by Arusha, and together we are the 2020 Second Youth Coordinators for Women in Global Health Norway. We are so excited to welcome you to the second webinar in the Inspiration series. Last session, we talked about women leadership in the private sector with Kari Krogstad. You can watch the recordings on our webpage in case you are interested in that. Women in Global Health has established a series for students and young professionals, and we are so honored to be moderating it for you. Today we welcome Dr. Bente Mikkelsen. Bente leads the Non-Communicable Diseases Department and the World Health Organization in Geneva. She has had multiple key positions nationally and also with the World Health Organization. She is trained as a gynecologist and obstetrician and holds a master's degree in health administration and management. Her current focus is on achieving the Sustainable Development Goals toward a reduction of premature deaths from non-communicable diseases in the context of the World Health Organization General Program of Work and working across sectors with multi-stakeholder using innovation, implementation, research, health literacy, and new technology pledges. We look forward to Bente sharing her experience, then discussing leadership and gender equality in regard to the benefits and barriers that still exist today. We encourage all of our viewers to interact by posing questions to Bente in the Q&A session. Welcome, Bente. The floor is yours.
Thank you very much, Laura. It's a big pleasure to be here, and it's a little bit scary to be the inspiration of the day, but I hope I can manage that. So I'm going to speak a little bit about headwinds and tailwinds, and also making mission impossible a little bit possible. I think that's my life until now, and also the pleasure with being leader and also in engaging in public health. So I will explain the picture afterwards, but this is actually from the Venezia Biennale, and it was a picture that inspired me a lot, and you will understand hopefully why. So as everybody else, you have parents, and these are some pictures, and then you understand how old I am, because I don't think you have seen anything like this for many years. So this is my father, my mother in the background. And I think what is extremely important, but also very unfair, that, you know, we are born in different families. So I have been the lucky one. I think many of us in Norway are very lucky. And it was a home that was really focusing on honesty, on humor, and also on very hard work. So I think that's sort of the core of what is me also through my life so far. I went to medical school in Oslo, and after some hesitancy, I decided to be a gynecologist and obstetrician. And I mean, the first experience I want to share with you is actually not about obstetrics or gynecology, but it is what I did on the sideline. So since my student days, I engaged in student policies, and I was having many different roles in the Norwegian Medical Association. So my first real experience was that, you know, through resistance, you can actually achieve something that you didn't expect. So I was running for the election to become the president of the Norwegian Medical Association, after being the leader of the senior physicians. And many people believe that, you know, since that should be the first female president, it was an easy thing to do, but obviously it was not. So I think what I learned from that is, and actually many people said, you should never do this, because if you lose, your life will be so miserable, you will be so sad. I lost. And what happened next was that many doors opened for me, which I couldn't even imagine. So I think one of the reasons why I lost was that I decided to keep my integrity. I could not sort of be part of a negotiation and sort of cross some of my own red lines. So I felt quite well being the loser and still keeping my integrity. And just some weeks later, I was offered to become one of the directors in the new regional health authority, which was part of the new health reform in Norway. So I think the first sort of lessons learned, at least for me, was that just do what you feel is right, dare to take big risks, it's not dangerous. And if you keep your values and your integrity, it actually is possible to achieve something else. You get visibility, and visibility is actually one of the few things that is important if you want to sort of move to next levels. I used this picture, maybe a bit unexpected, and of course it was a truly horrible situation that we all still think about as some of the worst thing that has happened to Norway in recent times. But I do it because I want to focus on leadership. And what I want to talk about now is how knowledge-based leadership and knowledge-based praxis and decision-making is so important, and is also important for the culture of leadership. So this was the 22nd of July commission, and in the middle of the picture, you see that one of the reasons why it actually went quite well, the way that the health system was performing, was because of attitudes, culture, and leadership. And as you remember, there were many places in the public sector that actually was not working so well. So health and rescue activities took care of the injured families and the acute phase in a good way. And I was especially pleased, but because at the time I was the CEO of the Southeastern Health Authority. And because of a huge change in the health system, we were able to work across many of the parts of the Norwegian health system. So this was in itself a good thing. So when I joined this structure, I think one of the things that really appealed to me was and it's actually through the Norwegian law system, that what we wanted to achieve with the reform, the hospital reform, was good and equal health services to all who need them, when they need them, regardless of age, place, residence, ethnic background, gender, and personal finance. If I should tell you about one thing that drives my passion, is exactly this. And I think that is something to really look into, because even if you have a sort of a less leadership function in any system, if you think about these things, try to address what kind of means and measures you have at hand, you can actually have a second job. You can do your job, but you can also actually contribute to equity in society. So in this case, this was the sort of the menu of action that was decided by the government. So it was a huge transformation that was expected, and I was the leader of this. The Norwegian health system, as you know, at the time was changing. So we got 4 regional health authorities, and this was actually the biggest, at the time, the biggest organization in Norway with 70,000 employees. And at the time, I think it was like 60 million Norwegian, 60 million Norwegian, 60 billion, sorry, Norwegian kroner, that was the budget. So you see that it was expected that we were able to change the system. So it was better coordination, better sort of strengthening of research, requirement of financial results, and so on. And many people don't know that this kind of leadership is actually requested and required also in the public sector. So on one hand, you can really engage in public health in this case, and equity. At the same time, you also have to apply exactly what Kari Krogstad was speaking to in the last inspiration session. And this is quite unknown, because people think one thing is the private sector, the other thing is the public sector, and this is super divided. To some extent it is, but you have to apply some of the same things. What is special with the public health system in Norway is that we need to add quality to the services. And I won't go through this, but quality is also how you use your resources. So if you choose to use money for one intervention in the health system, you cannot choose to use the same money for another intervention. So very much is really to use knowledge, to try to plan, to use the science that is under development, and try to create equity between different groups. So what I did together with the board and together with my leadership team was to develop a transformation program. So for many years, until I stepped down in 2011, we had these different sort of work streams that we worked on. So patient treatment, research, knowledge development, and so on and so forth. I will now go into the WHO part of the work, but before I go there, I just wanted to show you some of the few, it's like a cavalcade, you know. So what you could see is by hard work, we were able to reallocate money for mental health and for drug abuse treatment. We had a positive development in cancer treatment. We were able to actually do cost containment and control the budget from a very big negative result for many years. And we changed also the structure of the system. And when you do things like that, from many hospitals to less, you also have to see reactions. So you have to really be able to understand that many people don't really neither understand or actually agree to what is decided by a system like this. So this was 1st of May, I think it was in 2010. So I was even figuring in the demonstration. So coming back to knowledge base, so what was really enjoyable was to allocate more resources for research and innovation, and we really moved to 3% of the gross budget, and we were also able to establish innovations that still exist today, Invento. And I think the end of my career in this one, I would like to use this picture because we have to be humble. It was a fantastic journey, and it was only possible with all the people that actually are working in a system like this, all the advice you get from the patients, all the board members that are really investing, all the knowledge that is created. And the only thing to be is very, very humble. It is a very honorable and difficult as well, very complex assignment. So when I stepped down, it was a lot of, I would say, noise. I was almost figured in the media every day, and it was also a huge. It was one of the elections, so it was a lot of things happening. And in that case, it's extremely nice to have a family. Not everybody has that, but again, it's a privilege. And I think if I can give one career advice, it's always to have a private life and try to find a partner and somebody to be with that understand and can support you, because you will need that if you want to really climb the ladder, as you were asking me. So I will give you a little bit of a glimpse of what I'm doing now, and I will use one of these possible examples. And this is what I'm working on just now from Geneva. 100 years ago, Professor Banting discovered insulin. 100 years ago. Today, only 50% of those who have diabetes and need insulin can get insulin. And that is completely disgusting. 100 years of an innovation and only 50%. And to add to that, he actually promised the world that insulin should be for free for all who needed it. So we decided that we need to keep this 100-year-old promise. And there is all the reasons to do this. Many people think diabetes is not a problem because you can only get insulin, everything is fixed. This is one of the biggest epidemics among the non-communicable diseases. And it's of course because people are now getting more and more obese. It's a 150% increase since 2000. It is lack of diagnosis, lack of treatment, weak health systems. And you probably know that diabetes is one of the diseases that really affect almost all the organs in the body. So you can get blind, you can lose your limbs, and so on and so forth. And it's the only non-communicable disease that still is increasing in causing deaths in the younger part of the population between 30 and 70. So through WHO, and this is really a pitch for why you should come to WHO, we have convening power. That is one of the strongest things with WHO. So we decided to establish a global diabetes compact to bring all partners together. And we had heads of states and government, the former Prime Minister of Norway spoke, and we really brought all partners together. And today we are working in the program trying to give access to insulin and devices. We are developing technical products. We are looking into all the risk factors. We are doing country support. We are doing research and innovation, and we have people helping us to really look into research and innovation specifically for diabetes. I cannot speak to you without telling you that non-communicable diseases, and it's not even sure, I'm not even sure if you know what they are, but it's cardiovascular diseases, heart diseases, it's lung diseases, it is cancer and diabetes. And if you look at this slide, you will see that 74% of all deaths in the world. So by the way, it's not true, it's not COVID, it is actually these diseases that kills people. So you can see that ischemic heart diseases, the heart disease, the stroke is the most frequent one. And the underlying cause of this is hypertension, which is not difficult or very expensive to treat. So the impossible thing is that so many people are dying for something that it is possible to prevent and treat. And the possible thing is that we can do something to really curb this. And coming back to the women, I remember, this is one of my really, I would say, fond memories. I was able to meet with the executive director of UN Women. And it was during a huge conference in New York. And I showed her this picture and I said, you know, UN Women, you should really engage in non-communicable diseases. 6.2 million women die every year from non-communicable diseases. And she said, you are lying. If that was the case, I would have known it. So also telling you that these are the diseases that many people, they take for granted. They don't think about them. It's not the virus. You don't get infected, except that you will. Because if you adapt to smoking, tobacco, less physical activity, and unhealthy diet, you will actually get these diseases. It's also diseases with huge inequities. So coming back to my drive, my motivation, that we all have a job to actually try to improve inequities in society, any society. I don't know if I have any more minutes, because then you can wave if I'm soon to be finished. But I also wanted you to know that what has happened just now is that since we have had more than 2 years of COVID, we have disclosed, it has been like an X-ray, so we see how weak the health system is. So coming back to my former job, of course, I had this picture sort of as part of my, let's say, knowledge when we developed this health system. But still, I think we just now have discovered how weak, even in very high income countries, this system is. So this is a table showing that still now we have 50 to 60% disruption of health services for people who has these very, very frequent diseases like diabetes, cancer, and so on and so forth. So people are not treated, they are not diagnosed, and we have a huge backlog as well for treatment. So when I work in a line of leaders. So my big boss is Dr. Tedros. He's from Ethiopia. So we speak together, we try to have the same messages. So this is Dr. Tedros, it's also editor-in-chief from The Lancet, and myself trying to really convince why we need to focus on non-communicable diseases to be able to be preventing populations for the next wave of any pandemic or humanitarian crisis for that sake. So I think it's time to wrap up, isn't it? So one of the pleasures to be working in WHO is that I work with people from all around the world. So here you see some of my colleagues. And in my leadership team, we have people from Fiji, from China, from Australia, from Spain, from India, and so on and so forth. So if you like to work in a diverse situation, this is like a dream. So if the opportunity comes, say yes, and also rely on your network, collect the people that want to help you, that want to criticize you in a positive way, and then want to mentor you. And then you can find the key and use the latitude. So the picture, as you can see it now, is the key in the hand. So all the red things you see is actually millions of keys that was sort of imitating a sail for this boat that you saw in the beginning. Thank you very much.
Thank you, Bente, so much for introducing yourself. You're a career pilot at the WHO in the fields of non-communicable diseases, which is very inspiring. I especially liked what you said about following your own values and the topic you're passionate about, and also to still have a private life. I think that's very motivating and valuable, and also the whole insights of the World Health Organization. I think that was very interesting for all of us. So thank you. And Urusha will take over.
Thank you again, Bente, for letting us know more about yourself and your work. It was very interesting and captivating. And you have many years of experience in the global health context, and you are a very successful woman in leadership. I think we can all agree that your personal journey is a success story. So could you share with us some of your own motivations and what were some key elements that really drove you while making your way?
So I think I mentioned some of it, but you never plan this. I think what I would emphasize on is that if you're true to your own values and your curiosity, and you're sort of willing to go through some of the open doors that will probably come your way, then I think you can make a very nice journey. So I think being sort of flexible, also being a little bit courageous, very often saying yes to things that you didn't believe you were able to do, is very important, but also to be open for people who really wants to support you. You will always find somebody very close to you where you can ask, where you can get some support. These are very important things. And then, of course, to celebrate with the teams that you work in. It's never yourself, it's always you and all the people you work with. That's important as well.
Thank you for sharing your elements of motivation. I really agree with being open and grabbing the opportunities that come forward. And I'm sure you had lots of hardship on your way to success. And during your climb to the top, did you ever experience or feel at times more challenged simply because you were a woman?
I got that question many times. I think I can think about maybe one time when I was sort of very, very young obstetrician, and I was suggested for a very sort of prestigious board in mid-Europe, where I believed that my age probably and my gender had something to do. And actually the opposition was by much older women. But apart from that, it's very difficult to say. I feel that in all the leadership teams I have been in, and most of them I've been either, the only woman or few women's, I have never felt that, because I think when we come together and we are driven towards what we want to achieve, these things are really sort of coming into the background. And I have seen many of my male supervisors also having what we usually think as feminine values. They are caretakers. They are really sort of helping you, supporting you. So I don't see that actually, but I think it is a need for a push to make women, get these really high level positions. I don't think it goes automatically. But when you're in the position, I don't feel that this has been a problem.
I was curious to know that overall, and on the basis of your experience, what would you say is the main factor that makes an international organization such as the WHO successful? And do you have some examples of success while leading projects at the WHO?
So I think the whole UN system is a multilateral system. So I think that's the first thing, right? So, and everything is done by consensus. So you can never achieve anything without really having a full stakeholder engagement. So you have to, it's like in the Norwegian democracy and the Norwegian health authorities as well, but even more, to a much greater extent. You are not able to get anything through unless you have sort of worked through first the science, then all the knowledge base, then all the consultations, including all the NGOs and so on. So what makes it successful is the core values, or the core, both the values and the core functions of WHO. As I said, we are able to convene, and that is totally amazing. If I need an expert, like now we did a big resolution on oral health, for example, it is totally amazing. People just want to come, and it's not paid. They just offer their expertise and work with us. So that is fantastic. I will say, last 2 years, we have had so many achievements in the space of non-communicable diseases. We had the first resolution on oral health. So we now have been very clear that also the mouth is part of the body, and that's important, right? And we also have had the resolution on diabetes. We are just now developing an implementation roadmap. We have got funding, first-time funding, and actually the government of Norway is one of the most important, because they have included also NCD into the development strategy. So all of this is possible because there is political commitment. So I think sort of the combination of the convening power, the sort of the basis of knowledge research, and also the sort of the need, I would say, for these kind of resolutions is what makes it special.
Thank you for answering that question and letting us know that how much diversity is important for an organization. And now I would like Laura to carry on the rest of the webinar.
Thank you. I would like to move on with the topic of women leadership. We've already talked a bit about it, or you mentioned some things. And yeah, the pandemic has hit hard, especially on women that have been also great leaders in organizations. For example, by promoting emotional support and helping their employees to navigate work-life balance, which can be challenging sometimes. So maybe you could answer the question, what leadership or woman leadership means for you? And what do you think are important traits for leadership? I think at some points you already answered that question, but maybe you can go a bit more into detail.
For me, I think leadership in general is extremely important, and leadership and management is not the same, and both of them needs to come with the leadership. We can not become good leaders and being poor managers. But I think I have to just be personal, because the thing with leadership for me is that you have to be able to set visions, but that vision needs to come, with those that actually are affected by whatever that vision and the decisions to come with it is looking like, And then when you have put your goals and vision and got an agreement, then it's very important to be accountable, because there are far too many goals and ideas that is not coming true. And that is, of course, the hard piece. You have to be very focused, and you have to be very sort of stubborn sometimes, and you have to be flexible as well, because you need to sort of combine all these things together. I think the engagement, the involvement, and the values has to be there always. I don't believe we have good solutions with any of these things. So that's also my experience, both in the health authority, working with the patient organization, and now, actually now we are also co-creating solutions with the people living with the diseases, which is actually extremely important and interesting as well. So I could have said more, but at least that is some of the elements. So I wouldn't sort of stress female or gender-based leadership. I think sometimes that is even a trap, because we are very different as women as well. And, me and you necessarily be doing, we will not do this, we will not sort of do the task necessarily exactly the same. So I think it is more like, having these principles and values.
Yeah. And also kind of a personal leading style, probably.
Yeah, confidence, and also to build confidence, confidence and integrity, as I mentioned before.
Very interesting. Thank you so much for answering that question. Maybe you also have some examples. I'm going a bit more back to equality and gender equality again, in which you push gender equality at the World Health Organization. Are there some programs in place? Or, more importantly, do you push women into a leadership position or help support them during their way?
Now, first of all, we have gender equality and human rights programs in WHO, and more we also have sex segregated data, and it's very important that we use that. So in NCD, for example, using it as an example, of course, we know that male risk behavior leads to some part of the NCD agenda, while sort of more biological risk factors comes with NCDs for women and so on. So it's very important, I think, to build gender-sensitive healthcare system is important. But when it comes to how to stimulate, I would say, female leadership, of course, I am a feminist, so I have a special sort of view on my female staff, and I'm very sort of eager to see all my staff develop, but I'm especially sort of, I would say, I have an awareness, so I'm sure that the female staff feel comfortable in really setting their career goals and not sort of shying away from really putting them as high as they want. So in the UN system, we have a very good system that we every year have an agreement between a supervisor and the supervisee. And part of that is the development. So I have ample opportunities to actually guide, all my staff, and then especially women. And I'm very happy to say that it has been successful. So I think at the moment, 3 of my staff, only from 2 years back, has now get into director positions, coordinators position. And of course, I'm pleased, almost like a mother, for this, because it's so excellent. And I learned one time, actually from a man, that you should treat your staff as if they would become your next boss. So, and that's actually that's a good sort of, guidance for yourself when you want to mentor. You want to mentor in a way that you have a good boss, right?
That's very inspiring. Thank you for sharing this with us. Are there also some findings of gender equality and non-communicable diseases in this kind of fields? I know it's probably a huge topic, but maybe you can tell us the most important findings. That would be very interesting.
Yeah, as I mentioned a little bit, we talk about male risk behavior. This is, of course, it's very different from one country to the other and so on. But if we just speak about it like sort of globally, you could say that there is much more risk behavior towards alcohol, tobacco, even road safety, and of course, drugs and so on. So all of this leads, of course, to non-communicable diseases. While you can see in women, and again, it's true and not true, this one, you have a tendency towards obesity, lack of physical activity, and that again leads to diabetes, hypertension, and so on. So, and the other risk behavior is more towards cancer and so on. So we see differences. So I think more important is that if you look at how we can sort of work towards and towards more equitable health system is to focus on poor interventions, because unfortunately in many parts of the world, even in the poorer parts of any country, you can see that, the dilemma for people in sort of paying for their healthcare versus having food to their children is a very realistic one. So what we know is working is that we have universal health coverage like we have in Norway. So the more you reduce, the out-of-pocket payment for any family, this has a special impact on women. We see that in many, many countries, women with cancer, instead of seeking treatment, they provide their family with, for example, household clothes and food and so on. So that's very important. Then the other thing is to provide strong primary health care and community-based care. Again, the same, females over the world have very much more close to home, I would say, could be work, but could also be just that they have their work in the family. So to make this very strong, make it integrated, and that they can, for example, integrate screening of diabetes, hypertension, while they also seek support for pregnancy or even for their children. These are things that are very important. And then, of course, anything that has to do with social determinants of health. We know that the level of education, level of health literacy, all of these. So I think it's well known where we need to go. And many of the interventions is also general interventions. So I usually say that what is good for equity, for gender equity, is good for the population. So it's not like it's very special, but it has to have a special focus while we are implementing.
Thank you again for your comment on that. I would like to move on to another topic, or actually a bit to your advice for young professionals or students like us. What is your advice for us, having just started or are about to start the path of working life in the fields of global health? Especially also in working life? Maybe you could tell us a little bit more about that?
Oh, that's a big one as well, right? But
Sure.
I think follow your dreams and be curious. And I think you live in a very different world if I compare when I were at your age. Of course, it was still, the world was not as global as it is today. So I think you have so many opportunities to get experience from so many parts of the world. But I was completely unaware when I was a student or a young doctor that the UN provided such an opportunity. And I think it's very important if you are engaged in global health that you should seek the opportunities. So you can become an intern, you can become a young professional. There is also specific programs for young professionals from lower income countries, low and middle income countries. Also, to understand how to sort of maneuver and get into these systems. And also the Ministry of Foreign Affairs with their missions is also another entry point. They have 6 months practices that you can go for and so on. And maybe to assess, the different opportunities for taking a master in public health. Maybe combining it with another university, so you see another part of the world doing this as well. Another route into public health is, of course, through NGOs and organizations like Médecins Sans Frontières or Red Cross and similar. So there are many ways, and the system offers actually many opportunities. And the way to get in is very often easy to find when you first come to think about it on the web pages. But of course, if you want to seek advice, it's also very smart to find somebody from your own country, in this case Norway, so you can contact, people try to help as much as they can actually. So Norwegians is underrepresented in the UN, and the Ministry of Foreign Affairs try to encourage people to get into the UN also as young professionals.
Thank you. That's helpful for us, I think. Yeah, we would like to start with the Q&A, and Arucha will take over again. Thank you again, Bente, for all of your answers. I feel very inspired.
Thank you, Laura.
Thank you, Laura, for asking such important questions, and thank you, Bente, for your insightful answer. It is going to be very helpful for us. And now we would like to invite the audience to ask questions to Bente. Feel free to ask your questions in the Q&A box that is located at the bottom of your Zoom screen, and we will read them out. I think we have some questions already here, so I'd like to begin with one of them. So one of our audience who is working as a program manager NCDs in Zimbabwe would like to find out your advice on how one can manage to lead programs as a junior employee in a way such that the boss doesn't feel undermined.
I didn't really get it, so I got that it was an NPO in Zimbabwe, but I didn't get the core of the question, sorry. So undermining, what was that? Sorry.
I would like to repeat it again. How can one manage to lead programs as a junior employee in a way such that the boss doesn't feel undermined?
The boss. Okay, great. You know, I think most bosses, they will actually appreciate a sincere challenge, you know? I mean, if you, let's say, if we behave normal like humans and sort of make clear that this is really to make the organization improve, or because you have some specific ideas, you shouldn't shy away. And even if the initial reaction maybe is not sort of super positive, I wouldn't give up. I mean, this is where I say, listen to your heart and your curiosity. So I think just do it, even if you're pushed back a little bit. If they behave you know, in a bad way, don't accept it. And I think the UN is has an extremely high awareness for this now, and that is actually improved tremendously on the basis of very bad experiences. So if somebody don't treat you well, you know, then please use the system to get support. You know, there's always ways to get support, but most of the time, I think most senior people, they are very, very encouraged by younger professionals' ideas. Maybe they have to think about it, you know, a little bit, but then don't stop yourself.
Thank you. Moving on with the next question, which is about mental health. One person is asking, do you treat mental health under non-communicable diseases? Or do you have your challenges in that field as separate? And could you speak on how you view the importance of mental health in the field of global health?
Mm-hmm. So what is sort of steering the agenda for non-communicable diseases is the UN high-level meetings in New York. So the first time it happened was a political declaration in 2011, and it was actually the second time that the UN General Assembly discussed health. The first time was HIV. And then we have had two more of these meetings, and in 2018, the heads of states and governments also wanted to see mental health as part of the NCD agenda. So in one sense, it is seen as the sort of the fifth disease, if you want, or conditions. But at the same time, the mental health agenda is also much bigger than sort of the NCD agenda. So it's both its own agenda with its own global strategy plans and so on, but it's also a very important part of the NCD agenda, both as a risk factor and as a separate condition. So just in Geneva, where I work, it is another director who is responsible for mental health. While when I was director in Copenhagen, I also had this under my portfolio. And our friend in Zimbabwe, she has to do everything. So she has both mental health and the traditional NCDs. The mental health agenda is very important. And as we have seen now during COVID, we have seen so many mental health problems coming from, of course, the the lockdowns and many other things as well. So the good thing is that more and more countries see this, and it is really lagging behind when it comes to health system strengthening, access to medicines, all of this. So it's a huge, extremely important agenda.
Thank you, Bente.
Thank you, Bente. We have one more question related to mental health. So how to engage public sector and private sector towards mental health or health promotion in the developing countries?
So in general, when we, from a public health perspective and from WHO, we work with many different stakeholders. So we work with other UN organizations, we work with what we call WHO collaborating centers, academic institutions like universities, also non-governmental organizations, philanthropists, and the private sector. But when we work with the private sector, I think you understand immediately that, you know, we don't work with tobacco industry at all, because they produce a product that we know for sure will kill 50% of those who use it. It is absolutely a non-public health product. So we don't work with them. We have also strict regulation on how we work with alcohol industry. So we never take money from Heineken or something like that to do anything on public health. On the food industry, it's a little bit different. So we work with them, but we have specific frameworks for engagement. So this framework for engagement goes between WHO and any private sector. At the country level, it is depending on how the countries see these things, what kind of due diligence and how they see the influence from the private sector. Personally, I think it is very important that we engage the private sector as much as we can, but with very high sort of sensitivity, that we are not sort of having undue influence on how we choose the food we eat, or let's say how we organize our workplace, or how we develop our cities or whatever. But I think everybody has a role to play, except a few that we don't deal with in public health.
Thank you, Bente.
So we have another question. The person says, I have always thought getting into the United Nations is quite hard for us as young career doctors, because they usually want some level of experience. How can we get into the United Nations as an intern or new career woman?
So until I think I'm not sure, you have to check yourself if it's now 1 or 2 years after a master degree you can become an intern. Unfortunately, this has been one of the consequences of COVID, so still the intern program is closed, but I expect that it will open now in the summer. So that is an excellent way, because then it's also for you to test, do you like this environment? And you can also see it's so many different parts of the UN, so many even different parts of the WHO, many different offices at the country level, in the region, or, dealing with different things. So that is absolutely an excellent opportunity. If you have, of course, as a master, you have some specific skills. So another quite normal way is that you are appointed as a consultant. So you probably, like I have a consultant now that is helping me to program manage the Global Diabetes Compact. And he has a skill set that I really enjoy. So he has a combination of academic skills, but he has also been in an advocacy organization for people living with diabetes. So that is also a typical way. It is pretty hard to get directly from, university into these professional staff positions. But if you go to the countries, and I would definitely encourage you to do that, if you go to any of the countries in WHO, it's 194, and they very often have also staff positions, both in the normal country offices, but also, of course, in emergency operations. And this gives you also a very valuable experience. So if you choose to go this system, you know how this actually spells out at the country level. So that's a golden opportunity in itself. I cannot say it's easy, but it is possible, and you should never give up. And it's also an opportunity to contact, if you see some part of the UN that you really like, don't shy away from, try to call, try to contact, send emails. You will not always get answers, but most of the time you will. And that's also a way to get yourself visible. But when we come to the sort of the selection, it's very based on competency questions and very fair. So it's no favoritism. So even if I met Laura now, I cannot sort of prefer her to a job, to put it like that, and not Ursula either. So none of them, they have to go through normal selections.
Thank you, Bente. Since we are running out of time, I would like to take the last question for today's webinar. And it is, what is your advice on people who have different backgrounds in their undergraduate studies, but are passionate about the field of health disparities among underprivileged communities? I have a background in humanities, but I'm doing my PhD on health disparities regarding mental health among migrants and interdisciplinary research.
Mm-hmm. So I think with that kind of interest, it's a lot of opportunities. So for example, we have a specific migrant health program both in Geneva and in most of the regional offices of WHO. We also have programs that only focus on equity and diversity and human rights and gender. And almost all the programs need these kind of experiences and skills, even if they work on TB, HIV, all of this, because as you know, UN is all about leaving no one behind. So of course, it is an obligation for any program in the UN to apply these kind of thinking. If you want to focus on mental health, it is a specific mental health program in Geneva, but it is also regional advisors on mental health in all the regional offices, and some even of the sub-regional offices in the bigger countries like China and India. So there are opportunities, and you just have to try to see where you can find it. And a good way is to start just to Google WHO mental health, and you will already find things. Then, of course, it's other organizations as well that you could consider, like IOM, you have UNDP, you have many UNICEF. I mean, so many of these programs will, or organizations will also be of interest to you with that kind of interest and background.
Thank you for sharing information about that program, because I see that most of our viewers are interested about the information and the programs that you were talking about. But since we have little time, I would like to take one more interesting question, which is, which WHO best buys would you recommend as an urgent intervention as a life course approach to common NCD risk factor prevention and reduction in a young African population like Uganda?
It is a bit difficult to choose because we have 16 best buys, but the first thing is to focus on tobacco. That will make a huge impact. But in many African countries, tobacco is not so high than in other countries. So then it is important to look at the physical activity and also the nutrition side, because we can see that in the same countries we have hunger and childhood obesity, for example. And this, of course, leads to many, many different kinds of diseases, including a tendency to diabetes type 2 and hypertension. But I think if you only can choose one, it would be to focus on tobacco, and in countries where tobacco is still not so frequent, it's a golden opportunity to avoid getting this into the country as much as possible.
Thank you, Bente, for your insightful and informative answers and suggestions. I'm so glad that we are able to conduct the webinar within the time frame. Thank you, Bente, for taking time to join this webinar, and thank you for sharing your personal journey with us. Your experience as a woman leader at the World Health Organization, it was very valuable to learn what good leadership means to you, and also about gender equality in the global health field. We appreciate your advice for our young participants. Thank you again, Bente, and to our audience who are happy to see, and we are happy to see so many of you, and hope that you will join us for our next Inspiration series on October 10th with Dr. Andrea S. Winkler from Women in Global Health Norway and the Lancet One Health Commission. Stay tuned, and we look forward to welcoming you back.
Thank you so much.
Thanks a lot, Rusha, and excellent moderation for both of you. Thanks a lot. Bye-bye and good luck.